The Department of Urology here at Indiana University, it was established back in the 1880s. We established our residency program here in the 1940s, and that continued to lead to surgical innovation. Some of our history involves bladder augmentation in pediatric urology, congenital adrenal hyperplasia surgery in pediatrics. From an oncologic standpoint, one of the things our department is known most for is our development of the retroperitoneal lymph node dissection and the surgical technique around that for testicular cancer. We're also known for innovating what's called the Indiana pouch. That's a bladder substitution, largely used for bladder cancer patients. We have also done a lot of work in endourology with research around holmium laser enucleation of the prostate, high-intensity focused ultrasound treatment, initially benign prostate, and has moved into prostate cancer treatments. All of this technology was either developed here at Indiana University or brought to Indiana University in a very early setting. Another part was in kidney stone research, using the first non-invasive way to treat kidney stones using what's called ESWL. We had one of the first ESWL machines in the country, and that's led to a lot of surgical innovation, which has led to a lot of research. Our current research is largely focused in some of these continued efforts that we've been known for many decades. In prostate cancer research, we have researchers looking at basic biology of prostate cancer. We have clinicians looking at advanced imaging studies using PSMA imaging and how that can be used to guide surgical management for men who need their prostate removed. We have pediatric urologists trying to improve the quality of care for patients with spina bifida and urinary incontinence. Innovative surgical techniques in the pediatric population using robotics. That's cutting-edge research that hasn't been done elsewhere, and trying to understand that. And continuing to explore our testicular cancer patients, and continuing along the many decades of excellence done around that in research. And we want to continue to look at ways to improve our stone treatment for patients with kidney stones, and also men with benign enlargement of the prostate, and continue to do trials and innovations in that space as well. So my first touch point with the program here was when I came to become a resident at Indiana University in the department. The training here is and will always be very near and dear to my heart, and it's something that I'm going to continue to support because that level of excellence should be maintained. One of the reasons I came here was because of the surgical excellence of this program. The residents here are fortunate. We're the only academic program in the whole state of Indiana. That affords us to get all the bread and butter cases of urology that they can become exposed to, but also the most complex cases that they can become exposed to across the many disciplines in urology. That affords them some of the highest volume training in the country, and our residents are routinely in the 90th percentile as far as their surgical logs, and that trains them to be the absolute best surgeons that they can be. That's something that I'm going to continue to support, and also support their training outside the operating room, whether it's through simulation, robotic simulation. We have new faculty that are interested in surgical education and how to improve that, not only in your chief year, but from the moment you set foot on campus as an intern. How can we optimize your training that fits you and help you get to the maximum potential that you have?